Welcome back. Following the news this weekend that Lady Gaga has cancelled the rest of her world tour because of her crippling battle with fibromyalgia, we're taking your calls on chronic pain now.
Yeah, we're joined now by Dr. Michael Platt, who is a senior consultant in pain medicine. Welcome. Thank you for being here. We're going to start off with Shani, first of all. Hi, Shani.
Hello.
Hi. Thank you for calling in today. So you were diagnosed around about when you were 34?
Yeah, about 6 months ago.
OK, and before that, successful, working mother, no problems whatsoever, and this has completely changed your life?
It has, yeah. It's made things very difficult. But for me, I want to be a really positive person. I don't want to give in to fibromyalgia, so I'm doing my best not to just make it define me, but it is a struggle to not just be poorly.
So you want you want to know some alternative ways to help yourself, really?
Yeah, because I don't want to just give in and just take medication and then start the cycle of medicating, because sometimes they seem to mimic your symptoms. I want to find alternative ways that I can help myself.
I understand that. Well, we've got the expert here. Let's find out.
Thank you. Shani, I'm sorry to hear about your diagnosis. Fibromyalgia is one of the most difficult things we deal with. It is highly complex. If you imagine your nervous system as an electronic system, and all the brakes are off, so every single impulse that goes to the spinal cord is getting through to your brain, which normally wouldn't. And it's partly why you have so much pain. The question is how we limit the amount of information heading towards your brain and feeling painful. And one of the ways we can do that is with drugs, as you've alluded to, but special drugs that reduce the activity of the nerves involved. And there are two main groups that do that reduce the activity of the nerves and reduce the excitability of the system and try to make you more comfortable. In terms of non-drug therapies, it's been shown that moderate exercise, yoga, hypnosis and meditation can all be very helpful for a lot of patients, and these do seem to help calm things down centrally.
Have you tried any of those, Shani?
Yeah, I do exercise on a regular basis. It's very difficult because I push myself quite hard and I tend to push myself that little bit too far, and then I can start a flare-up. So I'm just trying to find something.
What about yoga? Because that's a bit calmer, maybe? Yoga?
It's really difficult. You do try different things, but again, there's a really fine line, and it's the fear of pushing yourself too far and beginning a flare-up that holds you back.
Yeah. That's a problem with lots of pain conditions we have. And one of the things that you need to be taught is how to pace yourself so that you're not putting yourself to the absolute limits, but doing it more slowly and more gently and working up slowly, a bit like an athlete training to his limits. If an athlete overtrains, they're in bed for 3 days. So they're taught to train to their limits and push the pain boundary as much as they can, but within their limits.
All right.
Thank you, Shani. Thank you very much. You've got Fiona, so she's talking about the medication route.
Yeah.
Hi, Fiona.
Hi.
So you've had fibromyalgia for 15 years.
That's a long time.
Yeah.
Okay.
Yeah, I've had fibro for 15 years, and I've tried the medication and cognitive behavioural therapy, and it didn't work for me. So now what I'm doing is I'm pain managing it on tramadol and dihydrocodeine, but I'm really aware of the symptoms that they can then cause and the damage they're doing to my body. And I'm just wondering if there's anything else I could possibly try.
It's interesting that you're using opioids to control the pain, because one of the problems with fibromyalgia is that the nerves that break the system actually use the mu receptors or the opioid receptors. That tramadol is an opioid, as is morphine, and codeine is a prodrug for morphine. And it may be that the drugs you're taking aren't that effective for what you've got, and maybe you need to explore other types of drugs that work more on the nerves that are involved in your condition. And that's one way of looking at it. In terms of how you take things forward, I think it's difficult. CBT doesn't work. You're doing moderate exercise, I trust, and yoga and that sort of thing. Have you tried hypnosis or that sort of thing?
I haven't tried
helpful
hypnosis. No, that's the one thing I've not tried. And I was trying to get into a hyperbaric chamber.
Yeah. Some people find that helpful, but it's certainly not universal. The problem with fibromyalgia is everyone's condition is their own. It's very unique. And we do think there's a genetic predisposition to it. It seems to run in families. And we don't really understand enough of the mechanisms that happen within the central nervous system that create this constant pain condition, unfortunately.
So she should go to her, whoever's treating her GP, and suggest another track of medication?
And if you go and see a pain specialist, they may be able to advise you better on on some better medication therapy. There are new drugs coming out all the time, so you may find one useful for that.
All right, thank you. Good luck with that. We've got Teresa on the line now. Good morning.
Hi, good morning.
So you're taking medication for your fibromyalgia, and you're wondering if there's going to be any long-term effects. So what medication are you on?
I take morphine twice a day and gabapentin 3 times a day. The gabapentin is quite high because I take 1,200 milligrams at a time. So with taking these drugs, I've had fibromyalgia for 4 years now. I'm just more worried about the effect on my kidneys, basically on my body.
Yeah.
Okay, so what are the long-term effects of
So in
these?
terms of gabapentin tends not to affect your kidneys. It's not like the non-steroidal anti-inflammatories, such as ibuprofen, which can affect your kidneys. Gabapentin doesn't affect the kidneys very much. It acts on the central nervous system, and it calms down some of these overactive pathways I've been describing. Do you find gabapentins helpful for your pain?
Yes,
Oh,
definitely.
good. So it's a good thing to continue. In terms of long-term effects, there's a lot of people who take it for epilepsy, for example, who have to take it lifelong, and they don't seem to suffer any ill effects as life goes on. So in long-term use, it doesn't seem to cause any particular problems.
Well, that's good news.
The morphine probably may not be that effective, although it may be helping you feel better. Long-term effects of morphine include, because the trouble is when your body takes morphine, it manufactures more morphine receptors. So to get the same effect, you need more morphine. So it's called tolerance. And that's the main side effect of morphine as it goes on.
All right.
Thank you very much indeed for that. We've got 10 seconds. Will diet help?
Diet is unlikely to help, but if you have an associated condition such as ulcerative colitis or Crohn's disease, you may find diet helpful in that situation.
All right,
Thank
brilliant.
you very much indeed for coming.
Coming up, we're going to be